In the name of Allah, who is most merciful and most beneficial. I'm Dr. Ambreen and I'm continuing with the subject Physical Agents and Electrotherapy-1. Today I'm going to deliver you a lecture on transcutaneous electrical nerve stimulation. It is commonly known as TENS in our physiotherapy field. And today we are going to study what it is, how we are going to apply it, what are the indications, what are the contraindications, and what are the basic physiology behind this. So before starting this, I am going to move towards the learning objectives of today's lecture. That actually includes the key points of the previous lecture, that is electromyography, transcutaneous electrical nerve stimulation that we are going to study today. And the next, inshallah, in the next session, we are going towards the topic of interferential therapy that comes under the medium frequency terms. Now, let me tell you about the previous lecture. Previously, we have gone through electromyography, the electrical activity by which we are going to use to diagnose the certain conditions and the muscles and the nerves, especially in the muscles. It's basically a clinical technique that involves the recording of the electrical activity generated in a muscle and muscle action potential. And today we are going to move towards transcutaneous electrical nerve stimulation. What it is, its application in these trends, we have an application of pulsed rectangular wave currents. We use this type of the wave currents in this. As you we know what are pulsed rectangular wave currents. These are the pulsed rectangular wave currents. So they are actually going to be applied on the person on the skin via surface electrodes on the patient's skin. There are different parameters that are actually present on the TENS machine as well that we have to actually monitor and through which we are going to convert and want our physiological responses. And what it is pulse shape, pulse width, and what it is, usually we said the pulse shape we use is a rectangular one, and the pulse width in the forms of microseconds is you can have a range from 50 to 300 microseconds, but commonly we have fixed it around 100 microseconds and 200 microseconds. The next is the frequency. This is one of the analytic parameter on the TENS that is starts from the 2 hertz. It may be maximum to 6 hertz, but usually what the TENS has is on the machine that we practically uses it has maximum of 120 to 150 hertz frequency. And can be varied from 60 to like 16 like milliamperes in intensity. And this is another parameter of TENS. And every patient have a different tolerances of tolerating this intensity. So intensity has no hard and fast rule that every person should have 10 or 20 or 30 or 60 milliamperes. It varies person to person from machine to machine as well. Person to person depending upon the tolerance level or sensitivity level. So coming towards the indication of transcutaneous electrical nerve stimulation, that in which condition we preferably use this. So actually we use it if we want to get the relaxation of some muscle spasm. So if we have muscle spasm and we want to get relief of it, we want to cause it to relax. So in such a case, TENS is a preferable modality. In order to prevent and retard the muscle disuse atrophy, to improve the blood circulation, to cause muscle re-education, immediate post-surgical stimulation of the calm muscles to prevent venous thrombosis. Actually, it maintains and increases the range of motion. It controls the chronic as well as the acute pains as well, if the person can tolerate it. Management of post-surgical pains, reduction in post-traumatic and acute pain. So it is going to ensure, going to reduce the spasm. It actually promotes the relaxation. It reduces the pain. It increases the range of motion. So these are the common like indications for which we are going to use transcutaneous electrical nerve stimulation. Coming towards the application of transcutaneous electrical nerve stimulation, it is a small battery operated. You can see in the picture, it's a small battery operated that can be even placed in the patient's pocket, and it has a conductive rubber-like electrodes that can have be adhered to the skin to its conductive rubber pads. The next, we said the conductive gel is also present. Sometimes we apply the conductive gel in order to get a more good skin contact. The electrodes can also be bandaged. They can also be placed on the point where you want to apply, then you may bandage it on the patient to fix them with adhesive tape. Coming toward the position of the electrodes, mean what should be the position of the electrodes? It's an area of the considerable debate. A number of approaches has been used, but according to which you can even apply on the painful side, on the dermatomes, on the myotomes, on the trigger points, on the motor points, on the acupuncture point, and appropriate peripheral nerves as well. So these were the electrode placement where you can possibly place your electrodes. Now, if we consider the positioning of the electrodes, that either it may be closed or uncrossed, horizontal or vertical. In case of tints, you can like adopt any one of the positioning method. It can be crossed, it can be uncrossed, it can be horizontal, it can be vertical. Especially when you are going to apply the interferential therapy, then you must consider that it must be applied diagonally. That is a hard and fast rule for that interferential therapy. But here you can adopt any one of the like mechanism, especially when you are going to do muscle stimulation. Then you must look for either you are getting where you are going to apply your active electrode and where you are going to apply your indifferent electrode. But when you are going for the pain management, you can like adopt any one of the pattern, any one of the area, and most commonly that we used as vertical or horizontal method. And especially around the like area, and you're going to actually cover that area. You're not exactly going to apply the left over the point you have the pain. You are going to cover the myotomal like distribution of that area. Now, moving towards the two commonly used methods according to the Claytons, that is from the Clayton, and according to which tens has been divided into two main categories, that is high tens and low tens. High tens is conventionally being used, and while low tens as actually have a low frequency, and it is going to cause follow the mechanism of counter irritation and going to cause the descending pain separation system. How and why I'll tell you soon. So this one is slightly having going to have poor compliance. You can see in the high tens, one thing you can see from this picture, there is high frequency of the impulses and they are of short duration and low intensity. And this is the preferably the characteristics of the high tens. Let me tell you about the parameters of the high tens. High tens usually have the frequency of between 100 to 150 hertz, the pulse width between 100 to 500 microsecond, the intensity between 12 to 30 milliamperes, and the patient's feeling is tingling, pins, and needle-like sensation in this case. What's actually going to happen? Why? What these parameters are actually going to do? These parameters are going to cause the muscle stimulation rate, and this intensity or this basically the frequency is sufficient enough to cause the stimulation of the like large diameter traffic, and it is going to cause death. As you are going to stimulate, it is going to carry through the large diameter efferent fibers. You are going to cause presynaptic inhibition of the transmission of nociceptor A delta and C fibers as substantia gelatinosa. So in this way, you are going to close the gates from this traffic for the small diameter traffic. Further, you are even going to use higher frequency than C and A delta fibers. So technically, you are going to block them by two ways. Coming towards the low tens, and it is less popular just because it have a frequency of 1 to 5 hertz. Means 5 hertz means you are going to have 5 impulses, 2, 3, 4, and 5. 1, 2, 3, 4. Mean you have only 5 impulses throughout the time duration. And these 5 impulses are going to give you a noxious stimuli. They are going to irritate you instead of going to get relief. And due to this irritation, they are going to activate the descending pain suppression system and going to cause the release of enkephalins and endorphins, and due to which you are going to relieve the pain. As I said, nociceptor stimulation is carried towards the cerebellum. It passes to the midbrain, causes the periaqueductal area and the riffing nucleus. To interact it to cause the substantia release of the opiate-like substances at spinal cord level. And these enkephalins and endorphins which are released are going to have an effect of blocking the forward transmission in the pain circles by inhibiting the substance speed. But the painful nature of this approach make it less popular and the patient and therapist, and so it has a poor compliance and maybe used in areas of damaged sensation where the patient doesn't feel it so much. And this is another mode of ultrasound, transcutaneous electrical nerve stimulation, that is burst type of TENS, in which you give a train of impulses and then give you a rest interval, then give you a train of on impulses. Let me tell you about the duration of the treatment with TENS. Portable TENS can be used and the unit switched on when required. Practically, the complete session, and when you're going to be the patient, you apply it for 15 to 20 minutes. You can. Now, moving towards the precautions and contraindications. The TENS precautions are the condition in which you are going to apply carefully, like in case of cardiac diseases, patient with impaired manipulation, patient with impaired sensation, in malignant tumors, and areas of skin irritation or the upper limb. Let me tell you about the contraindication, mean the condition in which you are not allowed to apply this grant, that are demand cardiac pacemaker, maker, unstable areas you're not going to apply over the thorax and over the chest, and over the carotid sinus, venous and arterial thrombus, thrombophlebitis, and in case of pregnancy, you're not going to apply over the abdomen, over the back, over the pelvis of the female. With this, I'm going to tell you about the therapeutic technique. In short, we are going to use for the pain management, muscle re-education, the muscle pumping contraction, or muscle strengthening as well. And with this, I'm going to close the session that modes of TENS. There are different modes of TENS: constant, burst, surge, sweep, and random. So depending upon the mode, we have different effects. So we may use accordingly if we want to modulate the pain. The best one is burst. If we want to get hyperalgesia, we may move with this mode. If we want to stimulate, we may use this mode. And we also want to use this mode in order to avoid the accommodation property. What it is we're going to study in the medical like medium frequency dance. And random mode is actually going to have a mixture of all these type of drugs. With this, I'm going to wind up this session. Inshallah, I'll see you tomorrow. Until then, Allah Hafiz. Stay home, stay blessed.